Garlic. What advantages does garlic have? In addition to being widely used as a culinary condiment, garlic, Allium sativum, has also been used medicinally for both prevention and treatment of a variety of ailments throughout history. The potential health advantages of garlic will be examined in this video, along with any studies that back up the claims. Quick facts about garlic. Garlic has been utilized as medicine for many years in many different nations. Both raw and cooked garlic may provide a variety of health advantages. It might have important antibacterial qualities. History. For thousands of years, people have utilized garlic in a variety of dishes. Garlic was reportedly in use some 5,000 years ago, when the Giza pyramids were constructed. According to Richard S. Rivlin's article in the Journal of Nutrition, the father of Western medicine, an ancient Greek physician Hippocrates, circa 460 to 370 BC, recommended garlic for a variety of ailments. Hippocrates advocated the use of garlic to alleviate weariness, poor digestion, parasites, and respiratory issues. Garlic may have been the first performance-enhancing substance ever used in athletics when it was given to the first Olympic athletes in ancient Greece. Garlic traveled from ancient Egypt to the Indus Valley's advanced ancient civilizations, Pakistan and western India today. After that, it traveled to Hina. Ancient Indians prized garlic's healing benefits and believed it to be an aphrodisiac. According to specialists at Kew Gardens, England's Royal Botanical Centre of Excellence, garlic was avoided by the upper classes because of its offensive smell, while monks, widows, children, and anybody taking a vow or fasting were prohibited from eating it due to its stimulating properties. Garlic has long been used to cure a variety of ailments, including bronchitis, high blood pressure, TB, tuberculosis, liver problems, diarrhea, flatulence, colic, intestinal worms, rheumatism, diabetes, and fevers in the Middle East, East Asia, and Nepal. The New World was introduced to garlic by the French, Spanish, and Portuguese. Uses. Garlic is being used frequently to treat a number of blood system and heart-related disorders, including as hypertension, atherosclerosis, hardening of the arteries, high cholesterol, heart attacks, coronary heart disease, and hypertension. Currently, some people use garlic to prevent colon, stomach, rectal, and lung cancers as well as the cancers of the prostate and breast. It's crucial to note that only a few of these usage have evidence to support them. The anti-inflammatory properties of fresh, raw garlic extracts are diminished by short-term heating, according to a study that appeared in the journal Food and Chemical Toxicology. Some folks who can't stand the taste or odor of fresh garlic may have a problem with this. Benefits. Below are examples of some scientific studies published in peer-reviewed academic journals about the therapeutic benefits, or not, of garlic. Lung cancer risk. According to a study conducted at the Jiangsu Provincial Center for Disease Control and Prevention in China, people who ate raw garlic at least twice a week during the 7-year study period had a 44% lower risk of developing lung cancer. The researchers conducted face-to-face interviews with 1,424 lung cancer patients and 4,543 healthy people for their study, which was published in the journal Cancer Prevention Research. They were questioned about their diet and lifestyle, including whether or not they smoked and how frequently they consumed garlic. A protective association between raw garlic intake and lung cancer has been observed with a dose-response pattern, suggesting that garlic may potentially serve as a chemopreventive agent. For lung cancer, the study's authors wrote, brain cancer, garlic organosulfur compounds have been found to be effective in destroying cells in glioblastomas, a type of deadly brain tumor. According to researchers at the Medical University of South Carolina, 3 pure organosulfur compounds derived from garlic, DOS, DADS, and DATS demonstrated efficacy in eradicating brain cancer cells, but DATS proved to be the most effective. This research highlights the great promise of plant-originated compounds as natural medicine for controlling the malignant growth of human brain tumor cells, said co-author Ray Swapan, Ph.D. More research in animal models of brain tumors is required before this therapeutic strategy can be applied to brain tumor patients. Hip osteoarthritis. Women who ate a lot of Allium vegetables had less osteoarthritis, according to a study published in the journal BMC Musculoskeletal Disorders by researchers at King's College London and the University of East Anglia in England. Garlic, leeks, shallots, onions, and rachio are Allium vegetables. The study's authors stated that their findings not only highlighted the potential impact of diet on osteoarthritis outcomes, but also demonstrated the potential for developing treatments for the condition using compounds found in garlic. The long-term study, which included over 1,000 healthy female twins, discovered that those who ate plenty of fruit and vegetables, particularly alliums such as garlic, showed fewer signs of early osteoarthritis in the hip joint, potentially a powerful antibiotic, according to a study published in the Journal of Antimicrobial Chemotherapy. DLEL sulfide, a compound found in garlic, was 100 times more effective than two popular antibiotics in fighting the Campylobacter bacterium. One of the most common causes of intestinal infections is the Campylobacter bacterium. This work is very exciting to me because it shows that this compound has the potential to reduce disease-causing bacteria in the environment and in our food supply, said senior author Dr. Xiaonan Liu of Washington State University. Heart protection. Researchers at Emory University School of Medicine discovered that DLEL trisulfide, a component of garlic oil, protects the heart during cardiac surgery and after a heart attack. They also believe that DLEL trisulfide could be used to treat heart failure. The gas hydrogen sulfide has been shown to protect the heart. It is, however, a volatile compound that is difficult to administer as therapy. As a result, the researchers decided to focus on DLEL trisulfide, a component of garlic oil, as a safer way to deliver the benefits of hydrogen sulfide to the heart. In experiments with laboratory mice, the researchers discovered that after a heart attack, mice given DLEL sulfide had 61% less heart damage in the risk area than untreated mice. Researchers discovered that garlic oil may help protect diabetes patients from cardiomyopathy. In another study published in the Journal of Agricultural and Food Chemistry, diabetes patients are most likely to die from cardiomyopathy. It is a chronic disease characterized by abnormally thickened, enlarged, and/or stiffened myocardium, heart muscle. The researchers fed either garlic oil or corn oil to diabetic laboratory rats. When compared to animals fed corn oil, those fed garlic oil experienced significantly more changes associated with protection against heart damage. In conclusion, garlic oil possesses significant potential for protecting hearts from diabetes-induced cardiomyopathy, the study's authors wrote. Human studies will be required to confirm the findings of this study. High cholesterol and high blood pressure. Ankara University researchers looked into the effects of garlic extract supplementation on the blood lipid, fat profile of patients with high blood cholesterol. The results of their research were published in the Journal of Nutritional Biochemistry. The study included 23 volunteers, all of whom had high cholesterol. 13 also had high blood pressure. They were divided into two categories: the normotensive high cholesterol group, normal blood pressure, hypertensive patients with high cholesterol, high blood pressure. They took garlic extract supplements for 4 months and had blood lipid parameters, as well as kidney and liver function, checked on a regular basis. Garlic extract supplementation improves blood lipid profile, strengthens blood antioxidant potential, and causes significant reductions in systolic and diastolic blood pressures. The researchers concluded after 4 months. It also reduces the level of oxidation product, MDA, in blood samples, indicating reduced oxidation reactions in the body. In other words, garlic extract supplements reduced high cholesterol levels as well as blood pressure in hypertensive patients. The scientists added that their study was small and that more research is needed. Prostate cancer. A study was conducted by doctors at the Department of Urology, China-Japan Friendship Hospital in Beijing, China, to assess the relationship between Allium vegetable consumption and prostate cancer risk. They collected and analyzed published studies up to May 2013 before publishing their findings in the Asian Pacific Journal of Cancer Prevention. The study's authors concluded, Allium vegetables, particularly garlic consumption, are associated with a lower risk of prostate cancer. The team also stated that because there are few relevant studies, additional well-designed prospective studies should be conducted to confirm their findings. Alcohol-induced liver injury. Long-term overconsumption of alcoholic beverages causes alcohol-induced liver injury. The researchers at Shandong University's Institute of Toxicology and School of Public Health wanted to see if diallyl disulfide, DADS, a garlic-derived organosulfur compound, could protect against ethanol-induced oxidative stress. Their findings were published in the journal Biochimica et Biophysica Acta. The researchers came to the conclusion that DADS could help protect against ethanol-induced liver damage, preterm, premature delivery. Microbial infections during pregnancy increase a woman's risk of having a premature baby. Scientists from the Norwegian Institute of Public Health's Division of Epidemiology investigated the impact of foods on antimicrobial infections and preterm birth risk. The findings of the study were published in the Journal of Nutrition. Ronnie Meir and colleagues focused on the effects of alliums and dried fruits because a literature search revealed that these two foods held the most promise for lowering the risk of preterm birth. The researchers looked at the intake of dried fruit and alliums among 18,888 women in the Norwegian mother and child cohort, 5%, 950, of whom had spontaneous PTD, preterm delivery. Intake of food containing antimicrobial and prebiotic compounds may be important to reduce the risk of spontaneous PTD, the study's authors concluded. Garlic, in particular, was linked to a lower overall risk of spontaneous PTD. Garlic and the Common Cold. A study titled, Treatment of the Common Cold in Children and Adults, was published in American Family Physician by a team of researchers from St. Joseph Family Medicine Residency in Indiana. They found that prophylactic use of garlic may reduce the frequency of colds in adults, but has no effect on the duration of symptoms. Prophylactic use refers to using it on a regular basis to prevent disease, though some research suggests that raw garlic has the most benefits. Other studies have found benefits in overall allium intake, both raw and cooked. As a result, you can reap the benefits of garlic in a variety of ways.